Hello, and welcome to today's video where we're going to be talking about myths regarding incontinence. Incontinence can be something that is tricky for people to understand, and there can be a lot of myths or misconceptions surrounding it that we hope in this video to clear up. The first myth we want to touch on is that incontinence only affects the elderly. It's a common misconception to think that only those who are older may experience incontinence, while actually things such as pregnancy, accidents, stress, or even medical conditions can all be factors which lead to one experiencing incontinence. Even those who are in their 40s or 50s may sometimes experience symptoms. It's important not to carry the stigma that incontinence is something only the elderly can experience. Myth number 2 is that not many people suffer from incontinence. A 2018 report showed that 37 million people in North America alone suffer some form of incontinence. That's nearly 10% of the total population. When looking at worldwide numbers, that increases to 423 million people worldwide, or almost 9% of the world's population. Myth number 3 is that it's normal to leak sometimes. Any form of leakage may point to a form of incontinence. If beginning to experience leakage, it's important that you consult with a medical professional at the earliest possible time. Myth number 4 is that bladder-related issues are inevitable with aging or childbirth. While giving birth can be connected to a loss of continence, it is by no means a guaranteed side effect. Similarly with aging, it is very possible to be 90 years old or even older and not experience incontinence. It's important to remember that those of any age or in any situation can experience incontinence. Myth number 5 is that incontinence is only triggered by physical activity. One belief is that the symptoms of incontinence are only triggered by things such as movement or strenuous activity. The reality is that there are a variety of mental triggers as well, such as hearing running water or even experiencing colder temperatures. Myth number 6 is that drinking less lightens the symptoms of incontinence. It would be a natural assumption to think that by not drinking as much, you might not experience incontinence as regularly. However, it is actually found that by drinking more sometimes in small doses, it can strengthen the bladder and reduce the symptoms of incontinence. So it's important to remember that even those who are incontinent should not fear drinking liquid. Myth number 7 is that men rarely experience incontinence. In recent years, a growing number of men have come to experience it as well, with leading causes being prostate-related surgeries, as well as workplace-related injuries. Over 300 million women around the world experience incontinence, while currently about 120 million men do as well. Myth number 8 is that incontinence is not serious. Incontinence can be connected to other health conditions, such as prostate problems or high stress levels. If one begins to experience incontinence, it is something that should be brought to the attention of a doctor right away. The sooner the reason for incontinence is diagnosed, the better. Myth number 9 is that Kegel exercises are only for women. Kegel exercises are a great way to strengthen the bladder muscles, and are certainly not something that can only be done by women. Men are increasingly using Kegel exercises to strengthen their bladder muscles as well. Myth number 10 is that natural therapies do not help. Like with keto exercises, there are many natural ways to help strengthen your bladder muscles and reduce symptoms of incontinence. Studies have shown that increasing the amount of magnesium and vitamin D in your diet can also help alleviate symptoms, and in some cases, help prevent incontinence altogether. If you would like to learn more regarding the myths of incontinence, please refer to the link in the description, which will take you to our blog, where you can read further about the myths that we have discussed here, as well as additional bonus myths as well. Incontinence is something that can be tough to discuss with others, but as time goes on, the number of people who encounter it is gradually increasing, and it's becoming less and less of a taboo subject. The most important thing to remember is not to ignore it, but instead address it as best you can. Never be afraid to approach a doctor or to receive medical advice. We hope that through hearing these myths, it has cleared up some misconceptions that exist regarding incontinence, and that going forward, you have the knowledge and confidence needed to address it properly.